Coming up on Mayo Clinic Q&A. While key indicators are dropping and Omicron fears fading, experts warn we're not out of the woods just yet. Plus, a look at recent research findings that could be cause for concern.
The numbers are clearly dropping. However, 98% of U.S. states are still at high levels of transmission. So when you hear numbers dropping, it's not the same thing as, okay, all clear, we can take off masks and not worry. We still have a lot of concern.
Welcome everyone to Mayo Clinic Q&A. I'm your host, Dr. Helena Gazelka. We're recording this podcast on Monday, February the 14th, 2022. So happy Valentine's Day. Today, Omicron numbers are declining and mask mandates have come in and gone out. And yet we are still in the midst of a pandemic. We welcome Greg Poland back, our expert from Mayo Clinic, to give us our updates. Hi, Greg.
Hi, Helena, and happy Valentine's Day to you.
Happy Valentine's Day to you, Greg. I'm glad to see you wearing your pink today.
I did, and a little bit of red. It's the closest I had.
That's wonderful. Well, Greg, give us the latest updates on numbers. Are we trending in the right direction?
Yeah, it's a real encouragement. And I say this somewhat concerned that people will take it out of context. The numbers are clearly dropping. However, 98% of US states are still at high levels of transmission. So when you hear numbers dropping, it's not the same thing as, okay, all clear, we can take off masks and not worry. We still have a lot of concern. We still have about 110,000 people in the hospital. We're still having about 2,500 deaths a day, and we're still having about 250,000 new cases a day. So this is not the time. I kind of think of it as, if you're in a 4-lap race and we're on lap 3, why would you stop and declare victory? Finish the lap and then win.
So Greg, if I might ask, what numbers are improving? Those numbers sounded terrible.
Well, so we were up at almost 1 million cases a day. Now we're down to 250,000. So hospitalizations just in the last week in the US have fallen by 20%. So both the acute indicators, number of cases, and the lagging indicators, hospitalizations and then deaths after that, are all dropping, slowly but surely dropping. So if we can convince people, hang on, keep wearing your masks, get vaccinated, get boosted if you haven't, I think we're going to get to a baseline level unless a new variant comes up.
So before that new variant comes up, we've talked before, Greg, about COVID in the animal population at various times. Now I've read something about it in the deer population. Is that a concern?
Yeah, we've talked a little bit about it in previous shows, and you're right. 16 states thus far have tested and found COVID in their deer population, and in something like 20 to 30% of the deer that they've tested, one deer in New York actually got infected, recovered, had evidence of reinfection. This is a major concern. The concern is that it will circulate in an animal population, then reemerge, what's called a reverse zoonosis. We give it to animals. The virus mutates in animals. They have slightly different immune systems, and then spread it back to humans in a form that our immune systems don't see well and are unprepared for. So we are watching that extremely closely. It's unclear how the deer are getting infected. Probably the best theory is through an intermediary animal that humans are closer to. Dogs, cats, rodents, who knows? There's a lot of uncertainty around this, but it is something concerning.
Greg, is it known yet if it's safe to, there are many people who hunt, we live in the upper Midwest. And so in Minnesota, people do a lot of deer hunting and eat venison. Is it known if that's safe yet?
No, that kind of close contact with an unvaccinated hunter and an infected deer Nobody's proven that it's gone from deer to humans, but it's clearly gone from humans to deer, whether an intermediary or
Okay.
not. So there is some concern there. There's no concern about eating properly cooked venison. It
Okay.
would be the contact with an infected animal.
Tell us what's going on with vaccines for kiddos under 5.
Oh, yes, this is very interesting. So the thought was that the FDA was going to review the Pfizer data. So this
Mhm.
pertains to the Pfizer vaccine for those from 6 months up to 5 years of age. Myself and a couple of other people did interviews concerned about this. I think the New York Times published my interview.
Why?
And
Concern?
we had concerns that the data did not show efficacy and in terms of antibody levels that matched what was seen. What was being proposed is give 2 doses so that if a third dose was necessary, they would be primed and ready to go. My concern, and again, we have pushed, even when people don't necessarily appreciate it, for transparency and honesty in this.
Right.
My concern was those data were not clear cut. And so I urged waiting, and I think wisely FDA took that approach and said, we will wait until there's third dose data before we make that decision and review the vaccine. I think that's the right decision to make. It's not risk-free, right? I mean, children will continue to get infected, but I think it's the right decision to first do no harm.
So any idea how long it will be before they have that next data?
Yeah, I think the third dose data they're talking about sometime in the March, April,
Okay.
maybe as late as May. I don't think it'll be that late. And then from there, a rolling submission to FDA to review those data.
Hmm.
So the idea would be, before fall time for sure, I think
Good.
we will have a recommendation for kids going to preschool and kindergarten and things like that.
Take care.
But in the meantime, I know that the public is weary of wearing a mask. I
Mhm.
know they think it's over. It is not over. The worst thing that we could do would be to ignore these recommendations and never get this suppressed down and have to just keep living with this and having new variants arise. So it is, whenever I'm in a public venue, I plead for people to wear their mask, protect themselves and protect people around them.
And it's so hard on the workforce too, Greg. I've said before on the podcast that my little grandson, who's 2 and can't get vaccinated yet,
Yeah.
has been quarantined 3 or 4 times. Well, it happened again last week. And so, of course, his mother, who's a nurse here, has to be home, or his dad.
Yeah,
So
there are a lot of
it's really
implications.
difficult when the little ones all need to
Oh,
be
yeah.
quarantined.
A lot of implications above and beyond health
Yes,
related to
exactly.
this.
Yeah, it's tough. Well, there was also some research about other long-term effects of COVID, including on the heart. Tell us about that, Greg.
Yeah, so this is a really interesting study. It's a retrospective observational study. So with all the provisos that go with that, they looked at a very large number. I think it was just under 300,000 veterans. And then they looked at about 5.5 million veterans before COVID and another 5.5 million veterans during COVID, but where they did not come for any COVID related, diagnosis. And what they found really pretty much astounded the medical world. They found some 20 different cardiovascular diseases that were increased anywhere from 50 to 70%, going out as long as a year. Now, what fits with that is we have cautioned people that even though you might have survived, and this includes even mild COVID, that does not mean that you are not at risk for complications and for end organ damage. And so they saw things like heart attack, stroke, pulmonary emboli, which are blood clots to the lung, myocarditis, atrial fibrillation. I mean, these are These are
Hmm.
potentially life-changing
Yes.
diagnoses occurring for as long as a year out. And this occurred in elderly people, young, healthy people who had no risk factors. So this is a serious finding. And people need to be aware of that in their decision making. The
Mhm.
other thing that came out, a related study in Israel, from Israel, showed that people who got the vaccine reduced their risk if they subsequently got infected, reduced their risk of long COVID and these kinds of symptoms by 50 to 60%.
Oh, that's
So,
significant.
what the data is showing as time goes on is you reduce your risk of serious illness, hospitalization, ventilation, and death. You reduce your risk of complications. You reduce your risk of long COVID. Now, you stack that up, all the benefits of getting the vaccine, you stack that up against the risks of getting the vaccine, which are measured in the handfuls per million. And so, again, there's no risk-free decision here. There is no risk-free decision. You are either going to get infected in time or you're going to get vaccinated. And vaccination is clearly the safest choice.
That's the word for the day, I think. Vaccination and mask.
And really, when you think about this, when you think, Helena, about the information you and I have tried to get out there
Mhm.
for going on 2 years now, you are really, I was sitting back and thinking, what's at stake here is
Mhm.
literally the health direction and the survival of humanity and human history. And yet people have been resistant to the data. They have operated on fear, on misinformation. And this is very sad for me and for you as health educators, as physicians. We want people to be safe. We want to acknowledge there are risks in getting a vaccine, but those risks are tiny in comparison to the benefits and the risks of not getting vaccinated.
Right. And then keeping up on boosters too, correct? Right, when they're
Absolutely.
offered.
And maybe we should say, because this is relatively recent information, I'm talking about mRNA vaccines now. You get your 2 doses, you get a booster. For people who are immunocompromised, there's a recommendation for a 4th dose. So they really get 3, if you will, primary doses, followed by a 4th booster dose. So
Okay.
for people who are immunocompromised, moderately to severely immunocompromised, we want to emphasize it's not 2 and done, it's not 3 and done, it's 4.
Okay. And it seems like that keeps getting extended. So who knows what it'll
It
be in
does. And
5
in
more
fact,
months, right?
on Friday, the CDC came out with a study, and I'll just briefly review this because it reinforces the need to continue wearing masks. And what they looked at is the efficacy of vaccine against outpatient visits and against hospitalization. So if you got a booster, okay, the efficacy against symptomatic disease went after 5 months from 30% up to about 87, 90%, somewhere in there. 4 months after that booster, that had fallen back down to 66%. So 40% of people who got a booster after 4 months are still, if exposed, are still likely to get infected. Granted, mild or trivial, even asymptomatic infection, but still infected. For hospitalization, 2 months after that booster, it maintained efficacy very well, 90+%. And by 4 months, it was still at 80%. So again, not perfect. And it's a reason to continue wearing your mask and physical distancing, particularly indoors.
So, Greg, any idea what's next in terms of variants? Now we're talking about Omicron that really had a surge and now it seems to be declining. So what's next?
I think the things that are being watched the most are so-called stealth Omicron. This is the BA2 as opposed to Omicron, the BA1. And then it's funny that they come up with these names, what's being called Deltacron, which has been detected now in the UK, which is basically a combination of Delta and Omicron. So you have all the severity of Delta with the extreme contagiousness of Omicron. So that's not a good sign, because remember that about 40% of the US population is not yet vaccinated. A good part because they're not eligible yet for vaccination. Right. Even among people who are eligible for vaccination, about a third of them have not gotten vaccinated. And among those who got their first 2 doses of vaccine, half of them have not yet gotten a booster. So we are still in a very, very vulnerable phase of this pandemic. And unfortunately, politicians and others are removing mask mandates, which is a signal, an inappropriate signal to the population of, oh, it's over. We've heard it's mild. We've heard cases are decreasing, but there's always a variant waiting in the background. And as I've said before, we've watched this movie happen worldwide now 5 times. And I keep saying to myself, when are we going to learn? When are we going to learn?
Speaking of movies, Greg, I was smiling while you were talking because these stealth Omicrons and Deltacrons sound to me like a Star Wars or Transformers or something like that.
That's how I know you have grandkids, when you know about Transformers.
Yes. Exactly. I have a few of those around my house that I step on sometimes, I think. Well, any last words for us today, Greg?
I think I want to be optimistic here. On the one hand, we're really seeing cases and hospitalizations drop. We're seeing the very beneficial efficacy of these boosters in preventing severe disease and moderate disease and protecting babies and pregnant women. But the other side of that coin is getting that out to the public and getting them motivated to act on those data instead of continuing to suffer this. Since you and I last talked, another 15,000, 20,000 Americans have died. And it need not be. How many more are going to die before we do our next broadcast together? And again, that is completely preventable. So I urge people, take advantage of what we now know after 2 years of data with masks, after over a year of data with vaccines, and take advantage of that and protect yourself and your family.
Show some love to
there
yourself
you go.
and to others on Valentine's Day.
On Valentine's Day.
And get vaccinated or boosted and wear a mask.
Yeah. If you want to show love to your spouse, to your children, to your developing baby, to your community, your neighbor, get vaccinated. Wear a mask inside.
Words of wisdom. Thank you, Greg, for being here.
My pleasure.
Our thanks to Dr. Greg Poland, vaccine and virology expert at Mayo Clinic, for being here with us today to give us our COVID updates. I hope that you learned something. I know that I did. And we wish each of you a very wonderful Valentine's Day and every day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.